Thanks, Colette. Well, Erica gave us the perfect segue for this panel discussion this morning, talking about the human aspects of the food system. We have a terrific panel of presenters today who come to us from wide-ranging paths to where they are today in addressing the regional needs. As part of the Food Coalition, I want to echo Colette's welcome to everybody and thanks to all who are participating in this in any way today. So first, let me introduce our panelists, and then I'll tell you a little bit about the format for our group discussion about their presentations. Our first panelist will be Dr. John Rusche, a physician and the chair of the board of the community advisors for the Lewis-Clark Valley Health Care Foundation. Dr. Rusche was born in Wisconsin. He attended Notre Dame and then Washington University in St. Louis for medical school. He served his internship and residency at the University of Arizona and began his pediatric practice in Lewiston in 1980. He became medical director for BlueShield of Idaho in 1995, and after 11 years, retired as senior vice president and chief medical officer for Regence BlueShield of Idaho and Regence BlueCross BlueShield of Utah. He was first elected to the Idaho legislature in 2004 and re-elected 5 times, which, as we know in this world, is no small feat. He served as House Minority Leader from 2008 until 2016. In addition to serving as chair of the Board of Community Advisors for the Lewis-Clark Valley Healthcare Foundation, he also serves on the Region 2 Behavioral Health Board. Our second presenter will be Mason Burley, who is Director of Research and Community Impact for Anovia Foundation. Mason was born in Spokane. He has his bachelor's from Western Washington University, an MPA from Evergreen State College, and a PhD from WSU Spokane in Health Services Research, which he earned in 2016. Mason worked 20 years at Washington State Institute for Public Policy, a nonpartisan legislative research organization conducting outcome evaluations and cost-benefit studies. He also serves as an adjunct instructor at local colleges and universities, teaching statistics and research methods. Mason enjoys running in road races and trail hikes in the inland Northwest. And our third presenter will be Colette DePhelps, who you've been hearing from this morning. She's Community Food Systems Area Educator in the Northern District for University of Idaho Extension. For more than 25 years, Colette has been working with farmers, community members, nonprofits, government agencies, and universities to develop community food systems and small farms programs. She's co-founder of Cultivating Success, Sustainable Small Farms Education Program, and co-founder of Palouse-Clearwater Food Coalition. Colette serves on Moscow's Farmers Market Commission. She's an advisor to Fair Idaho, a new trade association for independent food and agriculture businesses. You heard her mention George Scandalos, who'll be speaking today about that. She previously served as Executive Director and Special Projects Director for Rural Roots. Colette enjoys hiking and kayaking, preparing and eating local food with friends and family, and motorcycle riding on backcountry roads. So the format for our panel discussion today is going to be pretty jam-packed. We have a lot to fit in between now and 10 o'clock or thereabouts. So each panelist will present in succession. We will try to receive your questions through the chat as they're going along and intersperse your questions for each presenter in between their talks. And then we'll certainly have a moment for them to reconvene, to have discussion among themselves, and to field your further questions at the end of their talks as well. We're going to try to get to everyone's questions, but if we can't, we'll certainly have contact information for the presenters' organizations so that you can follow up with them. And then if you're not familiar with use of the chat, we'll try to watch for you to raise your hands in our gallery view so that we can catch your questions there. So be wild. Don't be afraid to just to let us know you're out there. So without further ado, let me introduce our first presenter, Dr. John Rusche.
Thanks, Nancy. I guess are you all hearing me okay? Because I can't tell.
Yes, you're doing great.
Okay, great. Next slide, please. I thought I'd talk a little bit about what the Lewis-Clark Valley Healthcare Foundation is. It was formed in 2017 when St. Joe's Hospital, previously a not-for-profit Catholic hospital, was sold to a for-profit hospital chain. 25 million of the proceeds of that sale were set up as the corpus, or the amount in the foundation. A year later, we started giving grants with a charge of promoting health, wellness, and prevention of disease in a 9-county region. That's Region 2 in Idaho. It's 3 border counties, Asotin County, Garfield, and Whitman County, and Wallowa County in Oregon. We have a board of community advisors that recommends who gets grants from that foundation, and now we give out approximately $1 million annually in two paths. One is what we call fast track, which is a minimal application process, and larger impact grants that we intended originally to be geared at the social determinants of health, some more upstream modifications that would have longer lasting effect on the health of the communities. Next slide, please. So we grant for things other than food security. In fact, our major focuses were, prior to COVID, to be access to health, housing, and mental health. And however, in our first year, and certainly since COVID, we've had a lot more requests for food security grants. Prior to COVID, most of the ones relating to food security involved food pantries, refrigerators, equipment, tires for delivery vehicles. One of them even wanted a new delivery vehicles with refrigerator in it. Also, some support for their space, including rent support, HVAC, so that they could be open in the summer and the winter, and a couple that needed new roofing. Some were for nutrition delivery, such as Meals on Wheels program. And there were a couple that were nutrition education through the food bank and through a couple of high schools. And occasionally there was a request for direct purchase of foodstuffs. Next slide, please. What we expected, we had our annual planning meeting in February of 2020, which is right before COVID was hit the screen. But when we heard about COVID back in March, we were unsure of what the government support was. I don't know if people remember early on, they didn't know who was going to get support from what department of federal government, when it was going to be available. And what we really expected was very stressed not-for-profit partners, increased demand on their services for rental support and for food, workplace changes. The people could no longer work in the same space. They'd have to figure out, like all businesses, how to do it on distant or remote, how to protect their employees and the people that they serve. We expected fewer volunteers, especially as many of the volunteers are retiree age that really were most at risk for complications of COVID, and less resources. If you can't have a group larger than 10, it's really hard to hold a gala. We also expected that there'd be less individual contributions as people's income decreased, and some of the large funders would be hit as they became unsure of what would happen in their market conditions. And we also expected that there would be many small not-for-profit organizations going out of business because they just didn't have the wherewithal to meet the needs. Next slide, please. So how we responded. Fast tracks, like I said, are grants that all you have to do is basically tell us who you are and prove that you're a not-for-profit, and it's related to health, wellness, and disease prevention in some manner. So we doubled the award for that and doubled the total budget up to $360,000. Those grants were gone within 3 months. We also made a contribution to a pooled community COVID response fund. The Anovia ran one in Washington, Eastern Washington, and one in Northern Idaho. And I'm sure Mason is going to talk about that later. But one of the benefits there is that they were focused on at-risk populations rather than strictly at the non-for-profits like we were. And then we did have impact grants. They were fewer in number, and because we had spent the money in other ways, and we also seen the grant requests were used primarily, not totally, but primarily the grants were focused on backfill of lost volunteers or fundraising. They needed to hire staff, whereas they had volunteers previously. So that's what we happened and had changed with our program. I don't know if my next slide's on here or we do that later. Yeah, I guess we'll do that later at the end when we talk about what we see going forward. So I tried to keep that in 5 to 6 minutes. I hope I was successful, and I'd be happy to take questions now or whenever Nancy says it's the right time.
Thank you, John. That was a powerful presentation. A lot of good information for us. There's this question here that says the Lewis-Clark Valley Healthcare Foundation invites grant recipients to share their follow-up stories. What sorts of things do they tell you?
Well, remember, we're fairly early in our evolution. We were formed in 17, gave our first grants in 18, and so follow-up would likely be not till 19 with the 18 grants. They give a grant in the end of 18. 19 is when they do the business, and so starting in early 1920, we started to get some reports. And most of the grants we first had were pretty easily tracked in number of people touched, et cetera, and not really on whether we made a dent in the problem that was being addressed. And that's one of the problems I see going forward is, how do you know you're making a difference with this wonderful asset that you get to distribute throughout the region? So we do know that there was a lot of successful food bank, and there were a couple health access programs, including a telehealth development. But some of most of the grants we gave in 2019, which is really our first full year of big grant, we're just starting to get the results of those back now. They were used during 2020, and now early in 2021, they're supposed to be reporting back to us. So I'm going to plead ignorance because it's really early.
Okay. Well, John, as a former member of the board with you, I recall hearing from, small rural food banks and such modest investments as freezer or refrigerator systems, or even heating and cooling systems for the food banks, made a gigantic difference in these small organizations, many of which had never written grant proposals before. So I applaud the work you're doing. I think it truly is a meaningful effort, and to partner with Anovia as you have in this realm. Are there any other questions? Do I see any hands raised, or anything else for the chat box here? Okay, I'm sure we'll have more as the discussions go along. With that then, and John's segue to Anovia, let me introduce Mason Burley, the Director of Research and Community Impact for the Anovia Foundation. Mason?
Thank you, Nancy. I appreciate the chance to be here, and thank you, Dr. Rusche and Colette as well. My name is Mason Burley. I'm with the Anovia Foundation. Anovia Foundation is the community foundation that serves 10 counties in Eastern Washington and 10 counties in Northern Idaho. That region includes about 1 million people, 35,000 square miles, and since we're talking about farm and food, it's about 22 million acres, I believe. So on the next slide, when I say that we serve that broad and vast region, what does that really mean? You know, the Anovia Foundation, we grant about $7 million to dozens of and a couple hundred nonprofits around that area. But we don't want to be just a pass-through organization. We don't want to be like a bank where we're depositing and granting out. What we want to be is a champion for communities. And so what that really means to us, and I think we have a unique role to play in philanthropy, is that we have to know the communities we serve. We have to understand the regional needs and opportunities. And then we really have to be able to support the community voice and increase participation in some of these activities. It's a team sport in terms of trying to better our communities. And so the way we went about doing that in the last year, it's been quite a year, as you all know, but on the next slide, you can see that we believe that to know our community, we have to be in our community. And for us, that meant kind of adopting a model that was used by the Oregon Community Foundation, where they developed some leadership councils in all of their different regions. And so we started that at the beginning of 2020 to create these leadership councils that really serve as ambassadors for philanthropy in their areas. They're volunteers, but they're trusted local voices. We're lucky to have a few on the call here today as well that serve on our leadership councils. But they're just people that know how to get things done in their community. And so we rely on them to work in partnership with us in telling us what is happening in those areas. And then also in sharing what some of our strategic vision is and some of our initiatives where we can work in tandem with people throughout this large and vast region. On the next slide, so in order to, once we, and those leadership councils are really about relationships. But once we form those relationships, we all need to kind of work from the same playbook in some ways. And for a lot of our efforts, that means working on accurate and informative data. And so we really were lucky to be able to partner with the LC Valley Health Foundation in 2019 as they began and ramped up their grant making efforts. We have an overlapping area that we serve as well. And so we did actually building on some work that Whitman County did, a community needs health and wellness assessment survey. We surveyed a random sample of 8,400 households throughout their 9-county region as well. And that was just a great opportunity to find maybe some of those voices that you don't read about and to hear firsthand to get current data. And we did find that that hunger is an important issue. It was, in terms of looking at the needs, it ranked 4 or 5 in many of the counties and the regions that we looked at. And more importantly, there was, the hunger was the people that experienced hunger, we were able to get a better sense of that. And it varied across these regions, but up to about 1 in 10 individuals. So we knew it's an issue we have to address and be involved in, I guess. And when you look, and sometimes the definitions are difficult for this, but it's important to, on the next slide, relate who this really means and how hunger can be experienced differently. As you all know, if you think about food insecurity, that number even increases. We have about 1 in 7 people in our area that reported they needed help getting enough food on any given time. So if we really wanted to truly live into our mission and be a community champion, we needed to be part of the solution. I felt like, we believe that. And so part of that one was educating the public. We have a video that we may see later here that we did in conjunction with some providers. St. John Endicott, Paige Collins, who is here, is featured on it as well. But we wanted to let our donors and partners know about this issue and how it's affecting families and households throughout the area. And that was recorded pre-pandemic as well. But the second part, I guess, is, in addition to educating, we need to be able to act and act quickly. And when the pandemic did hit in March, we were kind of at the stage of what do we do next? On the next slide, I guess this has been almost a year ago now, but nobody knew what to do. If you look at the date here, March 3rd, that was the same date we held that leadership summit. So we had 100 or 150 of those leaders from around the regions gathered in Spokane to talk about our strategic vision. And then everything started shutting down. You know, we, as an organization, your organization, there was some uncertainty and fear and doubt about how best to respond. This is my first pandemic. I think it's probably yours as well. But it became apparent very quickly that this crisis would affect the financially vulnerable hardest. On the next slide, this is just a simple graph that shows job losses across income quintiles. And very early, of course, it was those with the lowest income that were hit the hardest. And from the survey and assessment work we did, we already knew that economic insecurity was really acute in these regions, in many of the small communities and larger communities where people were having trouble making ends meet. So we knew that there would be, you know, a large effort required from philanthropy to respond to this and to help the recovery. So on the next slide, as Dr. Rusche said, we pulled together partners. We developed a COVID relief and recovery fund. And we were able to gather local, regional, and national funders and leaders to be able to pool our resources and mount a response in this area. And the nice thing about philanthropy is we don't have to ask for permission. In some ways, we're accountable to each other, and we're accountable just to the community. So we didn't have to wait for congressional approval to decide what to do next. The fund in itself in the coming months is raised, or the months subsequent is raised almost $3 million. That came from a lot of large name funders that you'll probably recognize on the right. And again, thanks to LC Valley Health Foundation. But we had 140 donations that were under $10,000. So it was also a mix of individuals and people in our donor community that really stepped up as well. And what we were able to do, I guess serendipitously, is use our leadership councils that I just showed you in each of those areas to get the dollars out quickly. So our first distribution went out in April, $780,000 approximately. And on the next slide, you can see that the priority for that kind of immediate stopgap round was small food banks. We knew that larger food distribution centers, the Second Harvest, the Idaho Food Bank, would have reserves that they could use, but all of these small food banks throughout this area, they needed assistance with non-food items. They needed assistance, as Nancy said, with freezers, with staff. Some volunteers, might be in a high risk group and weren't able to come in, so they had to pivot. And some of them also needed assistance with delivery vehicles to get out to some of these remote areas. So these are some of the food banks we granted out to in that early round. And we didn't ask for applications. We relied on our leadership councils to tell us, members to tell us what was happening in those areas. Then we would follow up and say, what do you need? So I think that worked really well. And as you can see, it was a big emphasis for that early part of our COVID relief. In June, on the next slide, we had a round two. And in this, instead of an application, we did a survey to organizations throughout this area and said, how are you responding? And food security topped the list. And this is actually in the, this does not include Spokane, it includes the Palouse-Clearwater Valley region. And food security continued to be a concern and a need experienced by there. So that was an area we also continued to support. But in this round, we granted to food banks as well, but we focused on community action agencies, people that were dealing with families that were experiencing job loss and other effects from the pandemic. That included grassroots organizations, many ethnically diverse organizations, churches, community centers and senior centers. We were able to kind of respond to some of those providers as well. So going forward, I think we don't want to take our foot off the gas. I'm going to save some of my ideas about resources for the panel at the end, but we want to continue to kind of amplify voices and meet those needs where they exist. I was shocked that, and we know those needs are continuing. I was shocked when I heard that all the job losses in December, 100% were from women. That doesn't mean that women and men both lost jobs, of course, but on net, men gained a small amount of jobs, but the females experienced a net job loss because of the shifting responsibilities in large part with the type of industry with childcare responsibilities, and families are scrambling to figure out, you know, now that a lot of the federal aid is gone, and we're kind of in this for the long haul, and we have all these phases now. It's still difficult on families, and it's difficult from different industries as well. And you can see the December loss by industries that are affecting many of the leisure and hospitality and other sectors more than us that are fortunate to be able to work remotely. So we will have another COVID round. We've kind of waited to balance those philanthropy dollars with the federal and state and other dollars that are going out. But we'll look forward to hearing from you and your organizations about how to meet the needs of people you serve in the months ahead. Thank you.
Thank you, Mason. I know you have that video loaded up here, and I think we have just a few minutes to take a look at that before we move forward with it. Is that right, Colette?
No, fantastic.
Great, thanks.
It's a passion of mine to make sure that children have food. The price of water and everything has increased so much in Endicott that people can't afford.
Food insecurity would be not knowing if that next meal is there, or is it the type of meal that you're able to sustain your health with. So that looks like skipping your own meals so that your family can eat.
I worked a lot of years in schools, and when you see kids tired and sleeping because they haven't had enough food, that affects their learning. So food is essential for good learning, and it's the way for them to grow and develop their own path.
The foundation wants to be more than just a grant maker, right? It's important that the work that happens in the community is really community directed. We want to look at how strategies are helping address food insecurity.
We have programs in housing solutions and community food. So we try to move individuals and communities to this positive future, and we really want communities and households to decide what that future looks like for themselves.
We have 50 families coming to the food bank. So the food bank falls in is really super important for them to take care of a lot of their needs, because it's right at the end of the month is when we give our food out, and they don't have a paycheck until after the first of the month. And I try to get enough stuff so kids that cannot afford lunches have something to eat.
I really believe that we already have enough of everything we need. It's just a matter of getting it to the right people at the right time.
I get telephone calls for families and stuff that say, hey Dave, you got some milk, you got cereal, you got some potatoes and onions or something? Well, we need some food. And I said, well, you meet me at the food bank then, I'll open it up and we'll get you what you need. That's 24/7.
The foundation can really be at the center, I think, and help organizations design effective strategies and then implement those out and be able to achieve the kind of dreams that they see for their community.
I imagine people coming here from other places to learn how this community figured out how to make sure that there's enough food for everyone, and bringing that to wherever they live.
I love the people. They're the nicest people, and the whole community is warm and friendly and accepting. And I see a lot of people wanting to support each other within the community. We all have to work as a team, because nothing happens if we don't work together.
Thanks so much, Mason. That was powerful. I think it's also a reminder of the pre-COVID days when hugs were so important to our interaction. And you kind of forget about those things, don't you? We had a few questions here, but I do want to share just an observation before we, in the interest of time, move on to Colette's talk. Dr. Rusche notes that women, especially those with kids, are quite stressed. Job loss or hours lost, kids at home and homeschooling, isolation and health issues. Also consider that they have to do the quote free and reduced lunch programs at home now. So bigger challenges ahead. Mason, I won't pose questions to you now. We'll give a couple minutes at the conclusion of Colette's talk for general questions from everybody too. So please put those in the chat box, or if you're not comfortable with that, raise a hand and we'll try to get to you. With that, let me reintroduce Colette DePhelps, Community Food Systems Area Educator for the Northern District at University of Idaho Extension. Colette?
Thank you, Nancy. I'm going to shift directions just a little bit to talk more specifically about what we saw as some of the impacts of COVID-19 on our local food systems. And so giving a snapshot of where we were in March 2020 and really using some information that came from an online survey that we did of Idaho's small farms and ranches. And then to talk about some of the market changes and innovations that were going on in the early season based on these needs. And then just a little bit about the gaps and challenges that this experience of COVID revealed. So prior to initiating this survey, which was launched on March 20th, which was actually before Governor Little initiated his orders to self-isolate. There were already conversations going around between farmers and farmers markets, in restaurants, in our Moscow Chamber of Commerce and other organizations about what are we going to do around food? Are we going to be able to have farmers markets? What is the impact going to be on restaurants and our food system as a whole? So the first question we asked people in the questionnaire that we sent out by email was, are your plans shifting with the current conditions? And so over 60% said yes, about a quarter of people said no, and then there were a lot of comments from people that they weren't quite sure. They weren't sure if they were going to have to switch plans because we didn't know where things were. We asked if they were shifting plans to please tell us how. And what we heard back from people, specifically from farmers and ranchers, that they were really thinking that they were going to have to change their marketing strategies. They weren't sure how they were going to get food to their clientele, to their customers. And a big piece of this is because we didn't know at that time whether or not farmers markets would be considered essential businesses. And we also didn't know if we could operate farmers markets safely. So people were thinking about whether or not they could do on-farm stands, whether they could establish or increase their online sales, how they might expand or start a CSA, maybe do home delivery. And some were anticipating that they were going to have extra product and that they wanted to be able to have avenues lined up where they could donate that to emergency food assistance programs. And then people were really looking at how they might have to change their farm management. Some were saying that they were going to increase production, others thought that they might have to decrease. But one of the things that we saw is that farms that did have employees were saying that they thought they were going to have to decrease their number of employees, develop contingency plans for safe operation, because what if somebody on the farm got sick? How were they going to harvest? How would they get food to market? And so this quote here, distribution, increased home deliveries, unknown farmers market availability, unknown wholesale contracts, increased food safety, who knows what else? This really demonstrates the amount of information that we didn't have at the beginning of the pandemic and the unknowns that our farmers and our other organizations like farmers markets that were supporting local producers were struggling with. When we asked producers what information they needed in this moment, a lot of people said they needed market assistance. And again, looking at those online sales, CSAs, how to promote their programs. But there was a really great need also for COVID-19 specific information. In March, we didn't know a lot about the virus. We weren't quite sure how it was being transferred, what the best safety protocols were going to be. And so people really needed that information and were searching for it. And then there was some unknowns about the financial situation. Were there going to be grants or loans for farmers? How should they plan financially for the upcoming season? Another quote, community supported ag. Someone needs to put together a web page where consumers and farmers and ranchers, artisan food service can connect directly in our local area. And this is because a lot of the way we have connected in our local food system and with our local producers has been through farmers market. And it's a relational situation, a relational marketing that is very localized. And oftentimes we don't have the systems within our regions where people can connect virtually and find each other easily. That's increasing, but not fully developed, especially in our more rural areas. So when we ask people to look a little farther out, out 3 to 4 months, and what were they going to need? People were really thinking that they were going to be back into looking at needing more education and resources around production and marketing, and that they were really going to have ramped up their food safety knowledge. So that was going to be something that they needed less help with looking forward. So again, looking for alternatives to farmers markets, looking for some of the safety basics when we're looking at harvesting and storing and delivering crops. And then again, there was a great deal of uncertainty. So through this survey and the comments that people provided, and then subsequently through many conversations that were convened by partners across our region, whether they were extension, farmers markets, farmer to farmer conversations, our community development agencies, and other nonprofit organizations. Through those conversations, a lot of gaps and challenges in our food system were illuminated that were really not new. There was a lot of demand for livestock that was anticipated, but we were missing sufficient processing facilities, especially USDA inspected facilities. We learned that many of our small farms and ranchers didn't qualify for federal financial assistance programs, and the ones that were coming out at the time were geared towards larger agriculture that were more likely to have employees, more likely to have production records, that were already in existing farm programs. That broadband was going to make it challenging for us to provide that COVID-19 education that was such a high priority, and that internet marketing is limited by lack of sufficient broadband. We didn't have complete contact information for small farms and ranches to reach out and know what everybody's needs were, but also to help them reach their customers through an online presence. And then our smaller farmers markets had really limited human and financial resources to implement new footprints and or the online markets that some of our larger farmers markets were able to do. And they were in a situation of looking at having to have delayed starts. And then again, many of our nonprofits, and this is something that John mentioned, they've been struggling financially already and had limited capacity to expand their services and be able to try new innovative programs that maybe would help meet some of the needs in our local food system. Some of the new challenges that were out there at the time that the pandemic hit was loss of restaurants and institutional markets. George is going to talk about how the restaurants were hit hard. Institutional markets like farm to school or selling into larger food service, those were lost because of the closures and people needing to stay at home and isolate. We had a lot of late starts for farmers markets, and we didn't know what the effects of those late starts were going to be on shoppers, and if shoppers were going to come to market and feel confident, and how could we help them know that farmers markets were a safe place to be. And we were very fortunate that very early on in the pandemic, Governor Little did identify farmers markets as essential businesses, so we could start planning around that, but there was a lot of work to be done. We also had really built a lot of our culinary tourism and events that focused on food, and those needed to be canceled. And those tourism events actually really relate to the success of our farmers markets. They relate to the success of our restaurants. And so what were we going to do? And then we found that, we were having some really limited production and marketing supplies. And some of those things like seeds became limited because we had this boom of people who started their own gardens and their own food production, which was an amazing show of resiliency in our community. It was also a challenge for some farmers because they weren't able to get the seeds that they were accustomed to getting. And then we all know that there were shortages of things like hand sanitizers, a lot of confusion around masks, limited access to masks, and other supplies that were really key to safely transfer food from the farm to people's market baskets or to their tables. So I'm just trying to set the stage for some of the challenges that we saw. However, when we move forward into our Ignite sessions, you'll see how our community responded to these challenges. So I'm going to let our Ignite presenters tell those amazing stories of how these challenges were addressed.
Thank you, Colette. I know we're short on time here, but I do want to follow up here and note that there are a few comments about gaps, including meat and poultry processing, mobile slaughter, the shortage of canning supplies, and those kinds of things. So I don't know if you want to speak about that now or you want to hold out until your afternoon presentation. Your choice.
I would just like to say I agree, and I love that people are using the chat to share this information. Please keep talking in the chat, because each of us has a small piece of this story, and it's together today that we're going to be filling out that story. So
that's exactly right. Rachel Clark points out that food insecurity and job loss and the uncertainties, the stresses on farmers and ranchers do not exist in isolation. In fact, domestic violence is tied in with all of this as well. And I know that Anovia has some piece in addressing that. Just any closing remarks from our three panelists before we move on to our Ignite sessions, and I'll turn that back over to Colette. Dr. Rusche, Mason Burley, Colette, any last comments before we move on?
Not really for me. I think interesting to hear other viewpoints of the last year or so.
Okay, excellent. And I presume, Mackenzie, we're going to save the chat messaging so people will have access to that as well. Great. Okay, Colette, let me turn that back over to you then for our moving into our Ignite sessions.
Okay, great. Thank you, Nancy. Thanks for moderating, and thank you to our panel members.
Yes.
So now we're moving into our Ignite session. If you haven't been to a food summit before, Ignites are 5-minute presentations, and the way they work is that the pictures that you see really are the background to the story that people tell. So Ignites are storytelling, and we ask people to talk about their experience when the pandemic hit and the innovations that happened to really show some of the resiliency and creativity and partnerships that formed across our food system. So we have 5 presenters in our first Ignite session, which is focused